Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone. Welcome to another episode of I Am You podcast. Today, we have been joined by Miss Janet. Janet VanBurger is a registered nurse, as she likes to call it, RN/BSN. Janet, welcome.
Thank you.
Yeah, because you earned that. You received the education, and once a nurse, always a nurse.
Yes.
Yes. I appreciate you for coming here, Janet. You know,
Thank you.
I think that knowing your background is very valuable to have you here, because even though these are stories that we are sharing woman to woman for other women, I think that it's also important for them to know that even us, with the preparation that we have, that doesn't make us exempt a cardiac condition, doesn't make us exempt to seek what is care and advocate for our own self. Now, you definitely have a different advantage to a lot of women that are listening to us today, because as a nurse, you have learned to advocate for so many people in your journey. You know, and patients are you become the advocate for your patients. But once you become the patient, how do you advocate for yourself? No, so let's start with in the journey of healthcare. What is your experience with people advocating for themselves? Are they comfortable with that? They're not comfortable? What is your experience?
Basically, they're very uncomfortable. People, especially women in my age bracket, the doctor says, then you do. No, the doctor says you don't do. You ask. And sometimes you have to ask numerous times or numerous doctors. For myself, yes, I'm a nurse. I have just celebrated 50 years owning those licenses.
50 years?
Yes.
Awesome. Congratulations.
Yes. The thing is, just because I have a license, 2 licenses actually, and a nice line of degrees, doesn't mean I know everything, nor does it mean I subscribe to taking care of myself. And it wasn't until the day that a female endocrinologist kicked my butt and said, you need to see a cardiologist because you're full-blown diabetic now. And I went, yeah, what do I need a cardiologist for? Well, you know, there's this little thing called the muscle, the heart. Yeah.
there's a little ticker in here
just might
that
wanna,
is silently keeping you alive.
You might want to take better care of it. And I was like, okay, but find me a clone of you.
Because you love her so much.
She was phenomenal.
She was a good advocate for you.
Extremely, extremely. She didn't take my attitude.
She was clear on what she needed you to do and collaborated with you.
And she even sent you a whole list of stuff ahead of time and warned you that I was coming through the
Beware.
door. Yes. And I will never forget the first time I walked into your office and I said, don't even. She says, yes, I know. I was already informed. I was like, oh, shoot, I don't even get a chance to throw it on the table.
I got to read your records before you come in. I was ready for you.
Yes, and I realized at that time, although I was knowledgeable on many, many different things, I was a trauma nurse, so you know all the body systems. I didn't know enough about the heart. In all honesty, as a practicing nurse for early years, I worked in a burn center, so heavy critical care. The EKG would do beep, beep, beep. I'd go, something's wrong with this. Mm-hmm. Why is it doing beep, beep, beep? And I'd call down to the OR and say to the plastic surgeon, the EKG just doesn't look right. Well, Janet, what is it doing? I don't know. I'm not a cardiologist. So they would laugh. But if I called and said it's not working right, they knew I knew what I was talking about.
Cardiac in general is intimidating. I think that, number one, the heart is what keeps us alive. So whenever there is something that doesn't seem to be right, we all go like, oh, what is that? What is that? But even though you were caring for patients that they all have heart, Janet, did you know that? They all have that little ticker that was keeping them alive. You didn't, in your journey, you didn't pay much attention to your heart itself.
Absolutely not.
And do you think that is, Actually, before, instead of asking you that question, I want to say, what do you think is the reason that you, even though being a nurse, did not know that heart disease was your number one health threat, particularly as diabetic?
Well, I didn't. I kind of did the ignoring the diabetes thing for too long, resistance. And I just didn't put the two of them together. Even though I learned it, I knew the basics from the books, I just didn't put the two together. And then my mom had a heart attack. And I said, we got a problem here. I better pay attention.
So do you think that it's also a failure of the system to make us aware?
Yes, most definitely. General practitioners, and there's some real darn good ones out there. I'm not looking to, but they see an overweight. At that time when I first, overweight, smoked for a period of time, and newly diagnosed diabetic, they don't want to, they just tell you, take this pill and walk every day. That was it. And I was like, wait a second, something's not right here. So I sought out a specialist. And from that, I started to learn that I'm a caregiver. I was born a caregiver. I'm still a caregiver. And I didn't care to take care of me because I had to take care of everybody else.
Which is a very common issue that we encounter with our women.
No doctor ever turned around and said, hey, you got to make yourself priority if you're going to continue to be a caregiver. I used to yell at my staff all the time, you need to get rest, you need to take the days off. How can I expect you to show up for work if you're not doing what you need to do for you? And they'd look at me and go, okay, yeah, I know, I do too.
Are you doing what you appreciate?
Mommy doesn't do what I say, not what I do. And it took a long time.
Do you think that, based with your role in the healthcare system and the direct contact that you have with patients, if we were to have our nurses be educated a little more to understand the importance of a woman to get checked, the idea of being proactive with their cardiac health, and of course, ingraining in their head that heart disease is our number one killer, you guys are a bedside with our patients. So will you think that more people in our community will be more proactive, or you think that would make a difference?
I think it would make a difference if it was approached from a happy educational point of view, a caring one that says, look, you're out here in the front line taking care of patients. As your employer, we need to keep you healthy. So we're going to give you all kinds of programs to help you. And we're not going to mandate that you got to show up, but we're strongly going to suggest it. And there might be donuts, but probably not.
We can bring some fruits and coffee.
Exactly. A few little tiny chocolate-covered strawberries. But I think we're not given... I don't think nurses have ever really been given the respect and credence to be looked upon as healthcare advocates for everybody because they don't get it for themselves. Mm-hmm. And that's why when you asked me to speak with you, I thought, oh, yeah, this is an opportunity to say, hey, fellow nurses, and no, I'm not practicing anymore. I still have active licenses, but I'm not practicing. Well, not getting paid to practice.
Mm-hmm. Exactly. I'm pretty sure you get all the consults and people asking you questions and what did you think about this?
As a healthcare provider in the past and still as an information booth, which is what I consider myself at times, it's nice to have the opportunity to encourage others to take a look. The doctor doesn't know everything, but unless you participate in your health care, nothing's going to happen. If you can't sit down with your doctor and say, whoa, wait a second, I don't understand what you're saying, and if he or she says, well, just take this pill, no, explain it to me. I have had PCPs since I've been down here that I actually got off the table, stood in front of between the laptop and the human and said, excuse me, I'm here, not in there. They jump back. How could you do that? Very easily. I am your patient, and it is my body, not a screen's body.
So I think that you actually mentioned something very important, which is you got to participate. No, because it goes both ways. No, we are facilitators in the healthcare, and it's a relationship. We go to school to acquire the knowledge to better treat you, but every human being is different, and every human being has different risks and different beliefs and different ways that they want to do things. No, but you got to be able to. You got to actively participate. So when you were directed to see a cardiologist, your doctor recognized the importance that a diabetic patient get their heart checked. What value did you found on that?
I could have kissed her because I wasn't doing everything right. I wasn't doing everything wrong either. But at least I knew I now had baselines to work with. And I think the funniest day was the day we got the results back from I'll say it wrong probably, the cardiac CAT scan where it showed, and it was so good. And I think we were both like, maybe you better call radiology and verify that.
But isn't that reassuring?
It was wonderful.
Because that way you don't have to worry that having the information is so valuable, because until you get evaluated, you don't know. Like your endocrinologist, well, for the audience, when we see patients that already have a diagnosis of diabetes carry a lot of potential problems for the patient. And one of the organs that get mostly affected by the diabetes is the heart. So when we see patients with diabetes, in our mind, we already know they have an increased risk for heart disease. So we tend to be much more aggressive with them. So knowing that is one thing, but also it's like, okay, so in what condition is my heart now? Because for you it was more of I'm ignoring my diabetes. I don't want to be a diabetic patient. And you were ignoring it, even though your doctors were like, they are telling you, no, this is a problem. But then, for that time that you did not receive the treatment, for you was more about, okay, now okay, so it didn't cause so much damage to my heart. It didn't cause so much problem, but what can I do today to move forward?
Exactly.
Now, I want you to share with me, I know that we always joke about not everybody has to be on medication, no? And you are one of those patients that feel like that. Like that's why you were resisting so much the issue with diabetes, because that will involve medical therapy. But when I invited you to come to join me on the podcast, you're like, are you sure? I don't even take the medications that you give me. But I think that it's important for our patients to hear this. You know why? Because number one, it is okay to say, I do not agree, or it's okay to say, I do not want to do it. No. So as healthcare providers, we are in a relationship with our patients. Our patients trust us with their life for us to care for them. We have a responsibility to not harm them and help them have a better life. But they're not obliged to do what we tell them to do. So there's something called patient's autonomy. And as long as we are clear that, okay, I'm a fellow of the American College of Cardiology, so of course I'm going to come to Janet and say, Janet, these are your numbers. This is what we need to do. This is what is indicated. This is what the data show. This is the mortality benefit. So many patients die. But at the end, you as a patient is the one that had to say, doubts have been clarified. You said ask question. Remember, you said ask question. Don't take it.
To ask.
If I tell you take this medication and you don't understand why you're taking it, then chances are that you're not going to adhere to that therapy. So ask questions. But even after you ask the questions, your doctor is there to clarify your questions. Don't ever take it because I said so for an answer. I think that's important for our listeners because I'm the doctor. How many times have we heard that answer? Because I'm the doctor. Okay, I understand that you're the doctor, but I am the patient, and I want to understand why. Because ultimately, I'm the one taking the medication. My responsibility as your doctor, because despite the fact that you make a choice, we are still in this relationship. Because my responsibility as your doctor is to explain to you why am I recommending this. Why is it recommended? Clarify your doubts, but at the end is your body. Patient autonomy. You tell me, I get it, I understand my risk, but I still don't want to. And I want the women that are listening to us to understand that it's okay.
Yes, it is. And one of the things I distinctly remember your nurse practitioner was in the room at the same time. She was like, can I get out?
They felt like they wanted to be a fly on the wall. They're like, get me out of here.
One of the things I distinctly remember when I was very emphatic, don't even
try.
mention the word. Don't even say the word. I turned around and at the same time I said, what other alternatives are there? What else can I do without taking statins? What else can I do? And you know what? You gave me answers. Now, some of them worked, some of them didn't. But you didn't go, no, you have to take. You gave me very distinct answers, and we followed up, and we're doing fairly good.
So 2 great messages in that statement. Number 1 is inquire over alternatives in the healthcare journey. Inquire over alternative because there always had to be alternative. No, so it's not just one size fits all. Every patient is different. And second is if your doctor should be willing to negotiate with you. And if your doctor feels that you're harming yourself with that,
they have to tell me that.
Then they have to tell you that.
So far, I haven't heard that from you, so it's okay. It's all good. It's
okay to say it. I don't agree. No, it's okay. It's okay to do that.
And I have done that, and at times I've even brought you in articles and said, you might want to take a look at this. Things are changing. The more knowledge we're acquiring, the more studies that are coming out.
That is great too. I think that is great because although we do have a lot of preparation, there's so much information that keep coming and coming and coming. I think that it's important also for patients to get educated, but also watch for the sources.
Exactly.
Yes.
Exactly.
What will you tell our women when they're listening to these quote unquote doctors in Instagram, YouTube? Because number one is
I have a real attitude about that.
Go ahead.
All right. My attitude is, first of all, you're on Instagram. It's an entertainment site. You're on Facebook and you join maybe 1 or 2 groups. I belong to a couple for diabetes, but they're monitored by professionals. You have to
know the credentials.
Know the credentials. Know who you're talking to. Somebody can get on and make all kinds of noise about, I shouldn't be taking this antibiotic. You don't know that until you talk to the professional. They have the knowledge. They went to school. They spent the time and energy. I tell people, click on to Mayo Clinic. It's a professional site. Click on to Johns Hopkins. It's a reliable site. And now Cleveland Clinic is another one. Go into hospital websites that have educational programs. Get real knowledge, not made up fake stuff.
Yeah, get relatable. Number 1 is reliable information. And there are some sources out there that, like you mentioned, a few of them that are clearly have made a path for reliable information. But also, even if you're using different other methods, like you mentioned, Facebook, Instagram, make sure that from whom you're getting that information had the credentials to discuss that. Plus, you always have to discuss with your providers because we cannot be giving generic statements about health.
Of course. And if you have multiple providers, you darn well better have them working together. I remember saying, will you work with her? Mm-hmm. Will you work with him? Whether it was to you or to another doctor. If you were not willing to work with, even though they're out of their practice, because now we have multi-practice people. Are you willing to work with the doctor at such and such practice? If not, I can't see you because I need somebody who's going to communicate. If you're not going to communicate, we're not going to have good success. And me dying or me being real sick doesn't look good on your record. I use that.
I hope we don't have to get there.
But at the same time, I recommend people to you frequently, other women and even some men, because I hear what's going on. You told me to get my tail moving. You didn't tell me to go to the gym. I started to go to the gym. I didn't have much of a choice. And it's amazing what you hear when you're working out. Huh? Where are you getting that information from, person?
Yes. So I think that we live in a world that there is so much information that it's about defining what is the right information. Yeah. And I hope that the women that are listening to us find this conversation that we're having helpful for them to help them navigate the healthcare journey. I think that if there is anything that we can actually leave them with, would be like, speak up, be your own advocate, ask questions. What else would you want to share with the women that are listening to us today?
I'm going to share something with you and the listeners. 2 years ago, I had a phone call from my cousin up north in New York, who is 10 years younger than me. She was in the cardiac care unit at a prestigious hospital out on Long Island. And I said, really? And are they doing A, B, C, and D? She says, well, nah. I said, no. You need to ask for this. Well, they're going to send me to a cardiologist when I get out. I said, really? Overnighted her your book.
Oh, you did?
Yeah, I got on Amazon and I said, get that book out there. And I think I even paid to have it delivered that night. I was desperate for her.
You don't want to listen to me.
I was desperate for her. She didn't want to hear me. I'm the older cousin. You're a nurse, big deal. You know how families can be sometimes.
Yeah, believe me, I know.
And we love each other.
I'm a cardiologist, but at home, I'm just a spouse.
No, yeah.
Yes.
So I overnighted her the book, and she actually read it. And read it, and then she chose her cardiologist up there, and she walked in with the book and said, my cousin said you need to treat me like this doctor treats her.
I hope. Well, we made friends then.
Let me tell you, her whole life changed when she realized some of the things she was doing were causing this problem. And it was just a matter of minor to some major lifestyle changes. She didn't get rid of her husband. He's too nice a person. Hey, stress does not help the heart. Ladies, men out there, stress does not help the heart. Don't think that, I can handle everything. No.
So you did not only receive the information, because that's one of the main purposes of this podcast is, I'm one provider, but I have so many people out there that can be my voice. And you've been the voice today, but you were also the voice when you share with your cause in the book. And she will be the voice for so many other women that are going to come her path. And that was actually the intention of the book. It has been the intention of the documentary. It has been the intention of the podcast. It's like, can we reach out to those women that don't know that we are different, that our symptoms are different, that our risks are different, and what can we do to be proactive with it? Well, I thank you. Thank you for accepting my invitation.
Thank you for wanting me. But thank you for being a very courageous, brave medical practitioner, because I know the world where sometimes being a woman, we don't get the respect that we deserve. And as a doctor, sometimes that's real hard. As a female physician, you are courageous, you are brave, and you're knowledgeable, and you got a fun office.
Well, I am so happy that we were able to build up that place for you guys to feel safe in a place that we can deliver that care for you guys, but also feel like family. And I really feel humble with the words that you're sharing with me, and I'm very grateful to have the opportunity to serve my community, including you. And this takes us to an end of another I Am You episode. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode, and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.